A normal vaginal delivery begins when the baby is positioned head down and the uterus starts coordinated contractions. During early labor, the cervix gradually opens from 0 to 4 centimeters. In active labor, contractions become stronger and more frequent, allowing the cervix to fully dilate to 10 centimeters. Once dilation is complete, the baby's head begins to descend into the birth canal, rotating to fit through the pelvis. In the transition phase, each powerful contraction pushes the baby lower. Crowning occurs when the baby's head becomes visible at the vaginal opening as the tissues stretch. After the head is delivered, it naturally turns to one side, helping the shoulders pass through one at a time. With one final push, the entire baby is delivered. The umbilical cord is then clamped and cut once the baby begins breathing independently. A few minutes later, gentle uterine contractions help detach and expel the placenta, completing the birth process.